Hello everybody. It's a little bit, how to say, difficult for me to speak after my previous speakers, which are sharing how the things are being taken care of from an administrative point of view, being the fact that even though we are part of the ECH Alliance ecosystem, we are coming from the ecosystem more than we come from the, how to say, administrative part or with the big power. So I will start. First of all, everybody knows where Scotland and UK is. Most of you have heard about Transylvania, but we are happy that Hollywood is providing every year a new reason to remember it. This is the region. It's northwest of Romania. We have several names: Transylvania, Erdely, and Siebenbürgen. It depends on the language. We are quite visible at the national level, and we are aiming to become more visible at the international level. Fresh Blood is a catalyst organization helping the people and the projects and to grow, and also trying to forge partnerships at the level, at the local, either private and public level, or also through international collaboration. Hence, we are also part of European of ECH Alliance. We are connected with the tech ecosystem, we are connected with the healthcare system, and at the European level, we are very well connected with European EIT Health, which is one of the few European organizations which are taking a closer look to the Eastern Europe and to Romania in particular. And our priority has been since forever to strengthen the community, to foster healthcare innovation projects, and to build partnerships. And now we get to the current point. I mean, the topic of the webinar is the hope. And the hope has to start, me myself being a doctor and project manager for Fresh Blood, with a proper understanding. So the start of the story is February 2020. Telemedicine in Romania is actually unregulated, hidden under remote advice, and practiced in psychotherapy. And there actually are a number of psychotherapists from Romania which are delivering the consultations all over the world, in the Romanian communities, but also outside of Romanian communities. I would like to remind you that we have an estimate of 4 million Romanian nationals residing either in Italy, Spain, France, and UK, just to give you an example. Then we have the COVID-19 impact. March 16, 2020, we have the emergency state in Romania declared by the president, and they begin to shut down movement of people, and they begin to prioritize resources. And what happened March 24, they decided that in the hospitals, including the private ones, you can only put emergencies in order to take care of them, and people over 65 can only leave the house from 11 to 13. Hence, they cannot go to the doctor. You all know that these kind of people are among the most in need in terms of medical services. The immediate consequence, medical activity decreased less than 80% in communicated and confirmed both at the private sector level and also at public sector level. Then we have the push, and in March 30, 2020, the government and the National Insurance House together accepted remote consultation, and only remote consultation, self-reported by the doctor through any communication technology. So there was no specification. I would like to remind you that currently there is no framework for telemedicine technical in terms of reimbursement of anything. They said if the doctor is reporting it, they can report it after all to get reimbursed by the insurance house. And I would like to pinpoint you this chart, which I find extremely relevant. We are very close to the technology part, and we have always seen technology as an opportunity. And I like this chart coming from a consulting company, which says that first of all, first mover in the new field, like in innovation, is the technology. Basically, we had the telemedicine as technology for tens of years already. Then you have the individuals, of course, as long as technology was only available for a couple of high-tech guys or to a couple of high-tech enterprises, this was limited. But now every individual has in his pocket something which can have a camera, something that has some sensors, and suddenly individuals begin to understand their powers. and not only use it, but also demand it to be used by somebody that's providing services for them. It's very common knowledge that doctors have their WhatsApp full with messages from patients, with questions, with advices, or even groups where they discuss things. Then you have the businesses, because they will see that technology and individuals become uh, how to say, familiarized, and there is maybe an opportunity. And then the last, usually, it's the public policy. And we have seen some examples of public policy actually embracing this, being prepared and being able to maybe split some priorities. And unfortunately, our public policy is still catching up on that. So what we have now, and that's the topic of our presentation, we have a compression of all these four things. So you have technology and individuals and businesses and public policies moving almost in terms of days. And this is solving, because now we have solve a problem. People, patients and doctors don't want to risk things that they can control through technology. So the next immediate outcomes, I'm talking April here. The major private healthcare providers have established their own telemedicine services in a week. Basically, they extended their IT services. They something, I would say, bricolage. It's in French. I don't know if the word is in English. It's just something handmade. It works. It's not regulated, but it can allow them to service the patients. The smaller healthcare provider begins to use some smaller solutions. There have been, as I said, some solutions used in other fields, and now they are coming to use in telemedicine. Individual doctors are actually using WhatsApp and FaceTime and phone, because phone is a technology. What we did as a community and as a catalyst organization, after being fed up with the calls and the messages about this telemedicine, what can be done, we started the Telemedicine Romania and Telemedicine EU Facebook group. On Telemedicine Romania, we have 1,900 members plus, and we organized 4 online events through Zoom and Facebook, and we had an audience of over 30K people, with people that actually doing telemedicine, with people that are actually using telemedicine. We had invites from France, a doctor that has built her own telemedicine platform. We have another supplier that proposed this in order to get the people along. What would be next? We do not know exactly. Currently, the emergency state in Romania will last until May 15. The latest data, we have seen some increases in numbers of consultations presented before. What we know now that private healthcare sector, 50% of their activities through telemedicine, and the individual doctor consultation is 80% through telemedicine. The public health sector, due to the fact they didn't have the financial incentives, actually one of the laws said the publicly owned hospital will get a lump sum in terms to be funded, and it's not going to matter how much work they do, which means that they have less incentive to move in this field. So it's moving to their level, but a slower usage, and mostly driven by doctors that have also public activity in the private sector. What we did as Fresh Blood, we initiated the coalition to make the telemedicine regulated. It's going to be a tough cookie. And also during last week, we coordinated Romanian EU versus virus hackathon participation. More than 1,400 people participated from Romania. And we are preparing the follow-up for the teams after the hackathon. In that hackathon about the challenge on telemedicine, I coordinated it, and it was something like 200 ideas. Many of them were from Romania, and we believe that these teams need a follow-up to become maybe part of the local ecosystem. We are constantly aiming for the partnerships. If you want, reach out. We are focused on Eastern Europe, Southern Europe, but open all over Europe through ECH Alliance, as is seen there. And if you want to join us on healthinnovators.eu. It's a Facebook group which is in English. We are communicating this actively. It's also available on LinkedIn, and we'll be happy to see whether there are opportunities to collaborate. Looking forward to have a better structured local ecosystem in Romania, and to forge partnerships with the members of ECH Alliance. Thank you very much. Hello.
Thanks for that. I can fully endorse that message, and I can say quite warmly that our ecosystem in Transylvania just gets on with stuff. And I think there is a really good example of a different country's approach where people have turned around and said, this is the technology, we're going to use it, get over it.